Good morning. Thank you for having me. So let's go ahead and talk about what is a geriatrician and do I need one? So what is it? Who is it? Who is the geriatrician? We're going to start saying the geriatrician is a physician who has completed a training in either internal medicine or family medicine, and also have gone through an additional 1 to 2 years of a fellowship training, specifically in the fellowship of the medical, social, and psychological issues that concern the older adults. Do you need a geriatrician? If you're getting older and having more health problems, you may want to consider seeing a doctor who specializes in this field, geriatric medicine. Geriatrics, well, this is important. It's a specialty, and it's growingly more and more important as the population ages, and that population actually lives longer. People over the age of 85 are the fastest growing segment of the population. So at this time, it's no longer a rarity for people to live to be 100 or more. Some statistics talk to us and said by the year 2030, when the last of the baby boomers reaches the age of 65, the US population 65 and older will exceed 70 million. This is approximately twice the number in 2000. As Americans 77 million baby boomers age, the need for healthcare professionals trained in geriatrics will be in really high demand. So we talk about geriatrician. We talk that the geriatrician is a doctor who specializes in the care for people 65 and older. And just as the pediatrician tends to the need of the child, a geriatrician cares for the special needs of changing seniors. Geriatricians approach each patient's need very individually. They possess the knowledge and the expertise that are needed to accommodate the seniors. They can better address issues like memory loss, arthritis, osteoporosis, mobility, Alzheimer's disease, among others. Clearly, geriatrics includes more than treating physical problems. It means recognizing how other health conditions can affect seniors socially and emotionally, and vice versa. This type of physician, the geriatrician, the practice exceeds diagnosing a physical problem and treating it. The geriatricians collect a complete information about the patient's lifestyle, the community they lived in, where did they come from, who's their family, what's their support. In one sentence, their entire medical history. Let's touch a little bit on the term of geriatrician. The most appropriate term for a physician who specializes in the care of older adults is geriatrician, not gerontologist. And I just want to touch a little bit on this because I have these questions all the time come along, and it's just semantics. A gerontologist is generally a non-physician, even though some doctors that mainly focus on research of aging can also be considered gerontologists, but geriatrician is the appropriate term. The geriatricians have developed and expanded their expertise in the aging process, the impact of aging on illnesses patterns, the drug therapy in seniors, the health maintenance, the rehabilitation. An example of this could be, we as geriatricians have these 1 or 2 extra years of the training. We go in deep detail about the physiology of aging. We call it like that. How we're different, how the seniors are different from the 50-year-old, from the 40-year-old, or from the 20-year-old. That is the aging system. And then we put that together on the overall evaluation of the patient.
Música